Hey, I have a really fun story to share with you. I had a patient come in. She was struck by someone going into labor. She was at a dead stop. The person rear-ended her car. This patient had terrible neck pain to the point of severe nausea and throwing up almost every day, terrible migraines when she came to see me. We kind of started off and saw that her neck was super tight from a whiplash injury, had very limited range of motion, not able to do a lot of muscle activation. She had burning, numbness, and tingling all the way down her arm, likely due to nerve involvement from all those tight muscles and just from that injury of getting the neck. Probably went into some hyperextension and stretched some of those nerves, so they weren't that happy anymore. This patient has been experiencing these symptoms for about 2 months, starting to not be able to work due to symptom intensity, not do any of the things that she loves doing, very active, outdoorsy individual. Couldn't paddleboard. That was one of the things that she really loved doing. Super sad. We started by just giving some basic stretches to start increasing some range of motion. We gave a special exercise. They're called nerve glides to reduce that tension on that nerve and start healing that nerve a little bit. And then come the follow-up sessions, we did some dry needling into the neck. The patient reported 100% relief with this dry needling. She no longer had burning, numbness, or tingling down that arm anymore. Directly after the dry needling, her pain was almost completely gone. She just had discomfort and tightness in her neck, but didn't have sharp aching pain or burning pain anymore. It was really cool to see. She ended up seeing a different provider. Whatever they did kind of aggravated her the next time, and she was back to her baseline. For my third session that I would have seen her at, we did the dry needling again, followed up with those exercises, progressed some of the stretches a little bit. Really cool confirmation of how powerful this approach to therapy is. After the dry needling, she didn't have any symptoms again. And then it was really awesome that that one stuck, and she was coming back to me and didn't really have any symptoms anymore. She would get migraines 2 to 3 times a week, still had some tension in the neck. So then we started pinpointing that tension in the neck. We started working the shoulder a little bit more, giving the shoulder some distraction, taking the pressure off of those nerves, continuing with progressing the nerve glides, and then really diving into some of those muscular restrictions in the neck, tuning and targeting dry needling with stretching and exercised based approach to getting her better. And after a couple visits, she was completely better. No symptoms anymore. Really awesome to see. This patient, just a little history, had also seen other providers, and her next best option was a total cervical fusion. So they were already talking, young patient too, of completely fusing her cervical spine so she would have no range of motion at all. As well as that, this probably not increase pain down the line. She'd probably have bad upper back or thoracic pain because she'd then have to start moving in excess to make up for the limited range of motion. Also think about driving if you don't have that range of motion to look behind you. So really cool that this person had such a great outcome with therapy, and I just had to tell everyone about that because it's so neat.